Hi, it's Matt Giggs here, and here we have our special guest for today. It sounds like a chat show, sort of radio show. It's not really. It's just actually we know each other, but I'm going to introduce you now. So this is Dr Nik Johnson, and how are you?
I'm very well. It's a nice sunny day outside, but obviously, like many of the rest of the population, I'm inside as well. So yeah, I'm fine. Nice to see you again.
And you, and obviously we've known each other for probably. Jasmine was in the room earlier, so we've known each other for probably 6 years, maybe 6.5 years since being in hospital with Jasmine. A long time ago, and you know, my wife has always, and I, very big fans of Nick and what you guys do as the NHS and as a paediatrician.
Yes, it's all part of a bigger team, though. Yes, I'm part of the paediatric team up in Hinchingbrooke, made up of just medics, but also nursing staff, the huge number of HCAs, the admin staff. Yeah, it's all a part of a small cog in a very big wheel within the NHS.
Oh, and you know, I think there's not one person who would be watching this who would be thinking with, you know, anything other than just total admiration for the whole of the NHS. And I said to you yesterday when we spoke, you know, at last we're going to start to see the people in society that just need that bit more recognition. And thank you for everything you're doing. And I'm hoping we can just share some more today, if that's possible.
Yeah. Well, that's very kind. I mean, I'd like to think that the NHS, you know, I think over many years, and actually since it was created, I think people within the United Kingdom do appreciate the idea behind the National Health Service. But at this current time, we are having a lot of people being very supportive, and that's very much welcome. But again, it's just to reiterate, it is a team, and there's plenty of other key workers who are doing just as important jobs alongside us to keep the country going at this time of the COVID pandemic.
100%. I mean, first of all, how the hell are you at the moment? That was one of my first question. How are you doing?
I'm probably like many of the others within, you know, society. And that, I mean, in a strange way, as a medic, and I'm sure this is true for some of my other colleagues, we have almost like the benefit of a sense of normality in that we're still going to work. And that's likewise with my partner, and bizarrely even our children, you know, because our two key workers, they've been going off to school. So in that sense, I have an element of normality. I'm sitting here at the hospital like I would be, but when I'm actually at work, it's very different. The kind of day-to-day work has changed, and when we are on the acute facing on the ward, where we're a reception ward for children who may or may not have COVID-19, we have to act very differently in particular regard to sort of PPE requirements, and that's difficult because that's changing the way we work in terms of how we have to interact with our patients and also the families.
And yes, a big adaptation then, yeah?
Oh, absolutely. Like nothing that we've ever had before, and hopefully won't have again in my lifetime or in my career. It's the main thing that's changed is, in some ways, the numbers of patients. Our routine workers had to just stop in order to minimise the churn of day-to-day work, and that by doing that, we limit the amount of patients, children, families that are coming to the hospital. Yes, they do need reviews, but these are routine reviews, and they can be postponed for a while. Obviously, we hope that they don't then develop into emergencies. But so from that type of work, that's not as common. And there's plenty of people within the NHS who, I can think of examples, for instance, like the ophthalmology department, hugely talented and skilled practitioners who are unable to do their day-to-day work because of the close-up working with, when you're looking into somebody's eyes, you have to be very close to people's faces. So that elective work, stuff around reviewing cataracts or other type of complex ophthalmology problems, they're not able to do that stuff, and they're having to be reassigned to the more emergency areas. And whether the really hard work that's going on, and credit to them, is the kind of intensive care units, both here at Hinchingbrooke and across the country. And certainly A&E departments as well. They're having to do make a good job of triaging, working out those people who are presenting who are unwell as to what sort of interventions they need, be it admission or ongoing care at home.
I mean, there's so much to consider at the moment for everybody, especially in Hinchingbrooke. I mean, how is it in the hospital right now? Obviously, no, if you're in there, it's pretty obvious.
So we have to take, we also, when we're in work, we try and adopt the kind of 2 meters of distancing. One of the I like working at Hinchingbrooke. It's very much a family environment, and so we're having to change the way that we interact amongst ourselves. Again, the routine stuff, some of the maybe more mundane tasks like auditing and reviewing our governance, which is important, but it's just in the grander scheme of things, we're not doing that at the moment. If I'm truth, I'm missing my patients. I'm craving normality. And on a positive note, as I've made it clear when I've spoken to friends and family and contacts via social media, and indeed on a day-to-day basis at work, I can, as a paediatrician, be reassuring that the COVID-19 crisis is very real for the country. But thankfully, for my group of patients, it's not one where we're seeing particularly acutely unwell children. So with COVID-19, our bigger problem is quite sensibly, a lot of parents are at home following advice as given by 111 primary care, saying, stay away from the hospital, don't spread the disease. And unfortunately, common stuff like pneumonias, not caused by COVID-19, or more, worrying things like meningitis. These things are being sat on, and certainly we've had examples of late presenting both medical and surgical complications. And so when we are seeing children, we often are seeing they're more unwell and they're coming in as an emergency.
Right. Okay. So I can understand that. I mean, sorry. Go on.
And I think that's also true in other areas of the hospital. I suspect there are aspects of medical care around common problems like management of diabetes, that maybe people who would normally have a more benefit of input in the community are having to survive a little bit on their own instincts, which in some cases can be good. It's empowering a patient. But serious complications can happen, and they are beginning to be seen now.
I mean, what's the general mood like around the hospital? Obviously, what I'm finding just running businesses is that there's a real togetherness in the businesses with the people that remain who haven't been furloughed, for argument's sake. And obviously, with the support from the outside and for all key workers, but especially at Hinchingbrooke, what's the mood like there at the moment? Because you're hearing about the hours and the risks and so on and so forth.
I think it depends a little bit on which area you're on. In my own area, we're having to, as I say, adopt a different way of working, but the support amongst ourselves remains. I think where the particular stresses are and people are at most risk, as we all are, if we're forward-facing in terms of actually contracting COVID-19, I think those areas, which is the intensive care unit, they're under incredible stress. And unfortunately, the truth is that the numbers of staff going off, be it because they've got to shield their family, shield themselves, also they get symptoms that I'm not sure if that is COVID-19. So that means there's quite a lot of churn in terms of the staffing. But the resilience that's within the NHS is something that we've learned year in, year out. I mean, ironically, the idea of winter pressures and the more variants of flu, we're used to working under pressure. It's just the outcomes in terms of the pressures that are in certain areas of the hospital now are just much more devastating. And I think at the moment there are members across the country working within the NHS who will just get on with the jobs. In some ways, I'm more worried about the longer term outcomes, about some of the stresses and strains and the implications around mental health, almost post-traumatic stresses.
Yeah, I was going to ask about that.
That's going to be something that's going to, I think in years to come, will become an issue.
Well, one of the things I was going to ask you about was the help that we can give the NHS as a community. And I think there's a lot of help and support that's being given, you know, certainly verbally given to everybody. Is it something that, you know, if people do know somebody in the NHS at the moment who is going through this terrific amount of pressure, is it just good enough for us to say, look, just give us a call if you want to talk, or offload? Because I imagine they're carrying a lot around with them at the moment. Just bear with me at the moment. My door's going. That would be one of my children. Hang on a sec. Jasmine, it's Dr. Nik. Look, here you go. Look, here she is. Here was our little our asthmatic, basically, and the
All
old.
right.
But you know, that's you raised such a good point, because actually, whilst you're in it and you're in the stress and you've got no time to think about the severity of the situation, and it must feel to these guys that they're on a treadmill.
Yeah, I think that's the case. Going back to your, you know, suggestion, I think within the NHS, often sometimes partners have similar, you know, we all have partners or not, but we have family and friends who are often in the same profession, but also in other key professions. So yes, talking is the most important thing, and offloading where you can within the rules and regulations that we laid down around social isolation. A hug can go a long way, or a virtual hug. And I just, there are some very simple tips that when you're off work, make sure you really are off work. You don't look at work emails. You try and relax. You have a bath. You try to eat well, and you sleep, and you get through it by looking after yourself, both physically and mentally.
And do you find that, you know, obviously when you're looking at that broader picture, you're thinking further down the line, just the immediate impact. So for things like testing at the moment for staff on the wards and stuff, are you starting to see that increase now, that ability to be tested?
No, we've got, I can only speak from my own experience here at the hospital. Totally. There's a sort of list of priorities for members of staff, particularly in those areas which are under the most strain around staffing and are the most forward facing. So where people are off work because they believe maybe they have to be because they've got a member of the family who is presenting with some concerning symptoms, there are routes for both the member of staff or indeed a member of their family to have access to testing. And on a very positive note, within the North West Anglia NHS Trust, that's been brought in-house, like many other hospitals trusts within the country. So we can get turnaround times. When 3 weeks ago, when we were first testing, results were taking up to 5 days.
Right.
Now we can get them back in sort of 24 hours. So there's been some very positive developments about that.
I mean, that's really good news, because obviously I'm not a big news reader, listener myself personally. And that's not to say that other people should follow that particular course. Yeah, Melissa, quickly say hello.
Hello.
Hello, Melissa.
You can't hear him. I've got my headphones on. I will in a second. I'll share it with you in a mo. But yeah, just looking at it. I mean, I suppose, you know, the news fairly representing what's happening in.
Sorry, interrupted. I think the news has been excellent in terms of how I've seen some really good stuff in the mainstream media about. Even before it really hit in this country, reflecting on stuff, I was looking at how the wave and how it was affecting countries like China and Italy. I think with the benefit of hindsight, I probably didn't actually take enough notice of it at the early stages to the absolute horror. But I've seen some excellent stuff where I think non-sensationalist and has really just shown that how people become unwell, that I think it's been reasonably balanced. I think there probably is an element occasionally of sensationalism and looking for an angle. In most recent times, it seems incredible that within our own country, our leader, Boris Johnson, our Prime Minister, he's actually in intensive care now. Reading between the lines, that has to be reported, but I think it would be too easy to kind of sensationalize that. And you struggle a little bit with that aspect, and you could argue focusing on a regular count, daily death count, as maybe we could balance it up with looking at some of the recovery stories.
Yeah, yeah.
Actually, it's a pretty horrific situation we're in, and I think to sugarcoat it too much and to maybe ignore it, if a little bit of sensationalism is used, there's a part of me says, well, maybe we need to, because I don't think the medical world quite were ready for it, let alone us as the general population. And if, we really do need to take it seriously, because there's some very serious things happening in the local hospital, and let alone nationally.
Yeah, and I think you can certainly see from the just from the countries that are maybe not coming out, but are kind of coming out, the amount of time that's required for us to take this seriously as well. You're talking months, not weeks or whatever. And I think, people, I mentioned to you yesterday, is it the suggested peak of this coming shortly? And actually it probably isn't really. It could be a little...
No. I'm not completely up to date with today's news, and I know there was talk about, some sort of dropping of restrictions. I'd be astonished if that's the case, because certainly in terms of numbers on a day-to-day count, certainly locally, we're still seeing people coming in and people being very unwell. So it wouldn't seem to make sense. But then ironically, as I say, it's sometimes a bit easier for me to say, because going back to your original question, my day-to-day life is much the same. But it must be difficult for people like yourself, business owners who are, you're now facing some very big dilemmas. Our local community, it's not just about when will the kids go back, it's when can we start running our business again, when can we start shopping normally, and when can we travel and visit our relatives again. There's so many bigger questions there.
Well, there are so many bigger questions, and I think the mentality side of things, keeping people getting people to maybe talk more at the moment, and to be able to express themselves a little bit more about the challenges that they're feeling is something that should definitely be encouraged. Because I think you're dead right on the business side of things. There's a lot of small businesses that are literally on their last legs because they can't financially be they haven't got the cash flow or whatever it might look like. But I think, in all fairness to the government, I think they really took some, big decisions early on in that, and they're trying to move things through quickly. And I think there's a lot of positives to look at within the business world as well. But going back to COVID, advice for people like us. So, we've got 3 children. We're, reasonably healthy people, and I feel like the demographic of who's likely to attract this is changing. In terms of, it was reported, generally, if you've got underlying health issues, or if you're over the age of 60 or 70, that seems to be. Are they kind of deliberately coming back round, trying to say, right, look, to get everybody out of the streets, if you like, or off the streets and be safer? Are they leaking more of the whole picture? I don't know. What's the...
No. I think it was maybe a phrase that's been bandied around, sort of, other health conditions. Plenty of people have other health conditions. One of the classic ones that we don't describe it, but is obesity. And, large proportions of our population are overweight. And that in itself is a pre-morbid condition, which is making the likelihood of severe illness significant. So I think there was a sense that this is happening to other people, the very old, or those who have some pre-existing condition. And it would be absolutely very, very wrong to assume that it can't affect the population above, above 20, really. There are some seemingly very healthy people who are becoming very, very unwell. And I wouldn't ignore there are possibilities of some children struggling with it as well. But, the idea that this is going to happen to somebody else would be folly in this situation.
Well, I think there's a lot of people that I'm speaking to now who know someone now who's either contracted it, or they've got the symptoms, or they've heard of people that have actually passed away. And I think it is becoming real for everybody, which is more scary for everybody in many respects. And, I'm an asthmatic. I've had asthma since I was 7. I've hardly used my inhalers for years. And it's crossing my mind now, and I'm thinking, right, okay,
I'd offer you some reassurance, because
Please.
Although asthma is a very common it's a relatively common diagnosis, well recognised in the sort of population.
Okay.
I think from what you're describing, your level of control is relatively good. I'm sure there'll be a few situations where you maybe struggle with your breathing, but the basics around those who have been asked to, you know, shield or take particular precautions with a background diagnosis of asthma, or those who have long-standing issues of poor control, having to use additional very, very regular doses of both oral and inhaled steroid to keep control, and basically people who with their asthma are in and out of hospital. So I'd like to offer you some reassurance, Matt. I think
I quite like my walks at the moment. I'm being honest. I'm enjoying a little bit of getting out, just appreciating life, and then getting back in again. But it's, you know, I was thinking I'm gonna have to stay in now, you know. But
no. I mean, I think, you know, that's where the balance is. You know, talking about, obviously we do need to stay in, and, you know, we've got the weekend coming ahead, and it's going to be a real strain on many families. Just the wish that, you know, because they've got, you know, we will all be thinking about where you would have been, what you would have been doing.
Yeah.
And who would believe it that the British weather is coming up to tease us on this?
Yeah.
That's very, very difficult. I mean, you are allowed to take some exercise within, you know, some very quite strict instructions, and got to maximize those opportunities. Not everybody has the benefit of outdoor space, but where you do, make sure you make the most of it. I've heard many people, and I've been very intrigued speaking to friends and family who've created whole kind of routines for the day. I'm sure routines important to include both physical exercise and mind exercise. If I could give one piece of medical advice, it's to, you know, look at the positives. You know, I from a personal point of view, I've been very impressed at, you know, having 3 children who are willing to re-engage with each other on a kind of sibling level, and find out about maybe also their parents. We're not, you know, the ogres that are always telling them to go off to school, and, you know, there are some benefits in this. It's strange, but that's how we're going to look at it.
Our kids are playing better together than they've ever played. So far, so good. Don't get me wrong, we've had some moments, but it's, you know, they're like you say, there's a lot of benefits. I think for a lot of people, reading, podcasts, webinars, getting involved with listening or learning how to play music, there's so many things that I'm hearing people who are taking up things, doing things in this historic moment, because it is a moment in history that we're in. And there are so many opportunities now to use this as a moment to remember, to look back and say, well, we've done that, we've done this. And actually, for me, I'm seeing, I feel like you're seeing maybe the extremes. Here you go, look. Can we have a barbecue, he said. That's brilliant.
Well,
I know. Well, we can. That's Dr. Nik. Can you do a quick wave?
Hello. Hi, Jude.
You remember, don't you? Yes.
Yeah.
And I think, like you say, positive mindset. It's not about, you know, anything other than what are you doing to work on that at the moment. And I think for the guys in your positions, it's probably something you're having to probably increase yourselves to do as well.
I think this, as well as sort of focusing on what you can do as an individual, I wouldn't want to ignore the potential, some of the wonderful things that people are doing out in the community, where they're supporting their neighbours. You know, the volunteering that happened in terms of the call to arms for people to help the most vulnerable in society. That, you know, that's people getting out of their own comfort areas and wanting to help people. So that can only be a good thing. I've seen lovely things about people just trying to, you know, going on a bear hunt, putting rainbows in windows, taking part in the clap on a Thursday for all the key workers. All of these are positives, you know.
Yeah, there's so many things that I'm noticing as well. You're kind of going, you know, St Neots. I think St Neots, and I can only talk from St Neots' point of view, I think they're doing a brilliant job. There's a load of positivity and there's loads of great things going on. And you know, I saw the guy that you shared, the guy kind of like playing his
Phil,
yeah, you know, there's so many good things going on at the moment. I think this is maybe, there is an element that I feels like it's kick-starting maybe something that we really needed also as a generation.
Possibly. It maybe the ultimate switching on and switching off the machine. Sorry, switching off and switching on the machine. By the way, Matt, my phone came up and said I might run out of battery. So if I go suddenly, I apologise, but I can keep talking. So
Okay, well, I might have a couple more questions. I just made a few earlier. I mean, I was obviously going to reference asthma, which you've tackled. Is there some, core fundamental things that you could share with us right now that, guys, look, just do this? I know there's the government guidelines, but just from your perspective, to protect ourselves, obviously.
To protect yourself, if you're not interacting with people who have COVID-19, you will not get COVID-19. If you're not mixing with people and they're not touching the same surfaces that they've touched, you cannot get COVID-19. So the idea of, in the extreme cases of shielding, is there to protect you. But it's on a bigger picture, and what we're trying to do as a community is work together by minimizing our interactions. Even though it hurts so hard not to have a hug. It hurts so hard not to be able to shake the hand of a neighbour. It hurts that you can't go down the pub on a Friday. It hurts you can't go and watch football, your kids playing, rugby down at St. Neots, whatever. There's a good reason for it, because in all those interactions, all those things that make us human, that's when we're sharing our own space. And unfortunately, sharing your own space now is dangerous, because it could have aerosol droplets that have a potential infection in there. And it's an infection that the vast majority of us will not be dreadfully unwell with. Some people will, but it can kill. And if it really, really harms 1% of the population, well, if you live in a population of 70 million, that's an awful lot of people. Now, we can't stop people getting unwell, but what we can stop is a lot of people getting unwell very quickly. And if a lot of people get unwell very quickly, not everybody will be able to be supported. If we spread that burden that is coming our way, the virus has won here, but we've just got to play clever to save as many as possible. So the advice remains the same. Stay safe for yourself, but stay safe as a community, and sort of minimize the amount of mixing, because in that way, your individual actions for the greater good will save more lives.
I mean, is there a possibility, before you go, that immune systems, how you can boost your own immune systems at the moment, would that help? Things like your diet or sleep well or whatever, rest?
Well, sleep well. There is some suggestion that vitamin D, vitamin C, supplementation, making sure that you're up to with your normal levels. It's well recognised that in the whole of the UK, and actually we would recommend all children to be on multivitamin supplements, because we don't get enough vitamin D in both in our diet, and we're not getting enough sunshine. It's really a bit of a grey area, because as it's a very novel disease, people are trying to work out why do some people get affected so badly and others not. I would just reiterate, good diet, the vitamin supplementation is certainly something, and of course, by minimizing your contact, you're not getting as much exposure, or the risk of exposure. If you don't have a massive exposure in terms of a viral load, then you're less likely to have a serious illness. So again, by minimizing your contact, you're restricting the likelihood of it being a serious illness.
And one last question, because I think it's important.
Yeah, absolutely.
For you. What's been the biggest thing that you've learned in the last 4 weeks about anything that's connected obviously to COVID-19?
Well, I've learned how to use Zoom. That's one thing.
That's good. So
I suspect it's like many people. I've learned never to take things for granted, like going for the walk with the dog in the morning. I'm lucky enough that I can do that. I've got space outside, but just being happy for what I've got, if I'm honest.
Absolutely. I think a lot of people would share those sentiments, Nick, and I'd like to say just thank you for giving up your time this afternoon. You're in the hospital right now.
I am.
Everybody will be sending their best wishes, and like you say, total recognition to the key workers that are going on and doing the tremendous work that's going across our communities at the moment. So thank you to everybody who's watching this, who's involved, and the support's been incredible.
Well, I'd take that back as well. Thank you, Matt. Thank you for your support. Thank you to everybody who watches this, people who, my other co-key workers. As I said before, we're all in it together. It's a community effort, and we will get through it. I know we'll get through it. We just
totally
admit the damage, and we'll learn from it, and we'll be better people. I'm sure we'll be better people.
Thank you, Nick. Have a great rest of the day. Take care. Stay safe.
All the best.
All the
See you,
best.
mate.
Bye.
Bye-bye. Bye.